Good, good morning everyone. I'm Dr. Mounika from NRIMS Vishakhapatnam. Today's my presentation is Pregnancy-Induced Central Retinal Vein Occlusion Non-Ischemic, a rare case report. CRVO occurs during normal pregnancy, preeclampsia, eclampsia or postpartum period. Hypercoagulability with increasing clotting factors, particularly 8, 9, 10 fibrinogen levels, and decrease in antithrombin 3 and protein C and S are important. Pregnancy alters the balance within the coagulation system in favor of hypercoagulability, predisposing the pregnant and postpartum women to retinal venous thrombosis. Even though preeclampsia and eclampsia during pregnancy is associated with significantly higher incidence of CRVO, it is rare to see thromboembolic phenomenon in normal pregnancy. Case report, a 21-year-old female from Vishakhapatnam came with a chief complaint of right eye blurring of vision since 2 days. History of presenting illness. Patient came with a complaint of blurring of vision right eye since 2 days, sudden in onset. No history of diabetes mellitus, hypertension, headache, vomiting, fever, cough, breathlessness, chest pain, sleep apnea. No signs of preeclampsia or eclampsia. No history of usage of OC pills, recurrent nosebleeds or increased menstrual blood flow. No history of pain, swelling in legs. No history of blood transfusions or easy bruising. No history of usage of any systemic medications. Obstetric history, she is primary gravid of 40 weeks of gestation with oligohydramnios. Past history, no history of similar complaints in the past. Personal history is nil significant. Family history, no significant family history. General examination is within normal limits. Vitals are within normal range. Systemic examination, perabdomen, gravid uterus present. CVS, respiratory and CNS examination were within normal limits. Local examination, head posture, facial symmetry, ocular movements or orbital margins are within normal limits. Ocular examination, right eye visual acuity is 612, improving to 6.9. Near vision is 6 and 6. Remaining anterior segment findings are within normal limits. Left eye visual acuity is 6/6. Remaining anterior segment findings are within normal limits. Fundus examination, right eye media coarse vitreous floaters present, intravitreal hemorrhage present at macular area, optic disc superficial hemorrhages present in superior margin of the optic disc with multiple peripapillary intraretinal hemorrhages, preretinal hemorrhage present at superotemporal to the disc, AV ratio 2:4, venous engorgement is present, FR dull macular edema is present. Peripheral retina soft X-rays present superior to the disc, rod spots are present. Fundus examination, left eye, media is clear, optic disc size, shape, color is normal, cup disc ratio 0.3:1, vessels AV ratio 2:3, macula FR plus and peripheral retina is normal. OCT macula of right eye shows increase in macular thickness. B-scan of right eye shows intravitreal hemorrhage. Hematological investigation where hemoglobin, hematocrit, MCH were decreased and eosinophils, APTT, prothrombin time and INR are within normal limits. RBS and creatinine is within normal limits. Coagulation profile where fibrinogen and factor VIII were increased and protein S was decreased. Provisional diagnosis, right eye pregnancy induces central retinal vein occlusion, non-ischemic, resolving state secondary to hypercoagulable state. Postpartum evaluation, patient underwent elective LSES, 5 days postpartum patient evaluated in ophthalmology OPD where ocular examination visual acuity improved to 6/6. Fundus examination, right eye 5 days postpartum where media is clear, optic disc resolving intraretinal hemorrhages superior to the disc, total resolution of peripapillary hemorrhages, cup disc ratio 0.3:1, vessels AV ratio 2:4 and venous engorgement present, FR plus and peripheral retina is normal. OCT macula 5 days postpartum, it is a normal study. Fundus examination, left eye, media is clear, optic disc size, shape, color is normal, cup disc ratio 0.3:1, vessels normal, FR plus and peripheral retina is normal. Coming to discussion, incidence of CRVO commonly seen in pregnancy associated with preeclampsia and eclampsia. It is rare to see CRVO in normal pregnancy as we have noticed in the present case report. Normal pregnancy is considered as risk factor for CRVO due to hypercoagulable state and incidence of venous thromboembolism during pregnancy is 6 times greater than non-pregnant women. The effects of progesterone on blood vessel walls results in venous stasis leading to CRVO even during normal pregnancy. To conclude, this case highlights the incidence of central retinal vein occlusion in normal pregnancy without associated preeclampsia or eclampsia. Evaluation of all pregnant women in 3rd trimester and postpartum period for hypercoagulability and exclusion of inherited thrombophilia will help us to diagnose retinal venous occlusions and management of related complications.